Brianna.
A report by the Society of Actuaries says that insurers will have to pay on average 32% more for claims on insurance policies, individual insurance policies that they purchase because of Obamacare, and that's likely to be passed on to consumers. It says that there will be a dip some places, but some states are going to see really big increases, like 62% in California, 80% in Ohio and Wisconsin. What do you think about those numbers?
Well, I think that you're citing a study that I believe was conducted by a health insurance company that's critical of the Affordable Care Act. So that part I'm not particularly surprised about. The reason that the Affordable Care Act was put in place was to ensure that we were expanding access to health care for every American, but also because we wanted to actually protect consumers who were repeatedly victimized by insurance companies. So it's not particularly surprising to me that an insurance company would conduct a study that was critical of a piece of legislation that was promising to hold them accountable for their actions.
But can you talk about some of the numbers? I know that there's some contention with the way that they've what they've factored in and what they haven't factored in. What do you think about that?
Well, I know that you should check with the Department of Health and Human Services, who may have some more detailed information on this. I know that there are some assumptions on there that are spurious at best. But there are a number of things about the Affordable Care Act that, at this point, are inarguable, at this point, if you will. The Affordable Care Act has already saved consumers an estimated $2.1 billion on their health insurance premiums that probably otherwise, were it not for the Affordable Care Act, would be an additional $2 billion that were paid into the pockets of insurance companies like the one that funded this study. Once the law takes full effect, it will have the benefit of increasing competition, driving down costs, and result in average premiums that are lower today, that will be lower in the future than they are today for the same benefits that are being provided. And that's an analysis conducted by the Nonpartisan Congressional Budget Office.